Hi, everyone. Welcome to those in the room and folks online. I'm Jackie White Hughto. I'm an associate professor in behavioral social sciences and EPI in the School of Public Health, and I'm one of the co-leads on the community engagement and outreach core of Advance-CTR. Today we'll be talking about what are community engagement studios and how do you integrate them into your research. So just to give you a little background of myself, I'm trained as a social epidemiologist, and I've been doing community engaged research for the past 16 years. A lot of my work looks at multi-level risk factors for health inequities with a big focus on stigma and the health of sexual and gender minority populations and people who use drugs, as well as folks living with and at risk for HIV. And I use a lot of my epi work to translate it into multi-level interventions from individual and interpersonal type interventions to policy interventions. And then I use a lot of my findings. I've had the opportunity to serve as expert witness on several federal lawsuits to uphold civil rights protections for marginalized folks. So about Advance RI-CTR, so Advance Rhode Island Clinical and Translational Research. It's a big infrastructure grant. We're in the second renewal. Each grant period is 5 years, and we're getting ready to work on our third renewal. Essentially what we do is we support Rhode Island researchers through funding, research resources, services, and professional development offerings. And really we want to build the training capacity to help folks be able to write grants that can serve the diverse needs of communities in Rhode Island. And we are based at Brown, partnered with URI, and also serve the VA and affiliated hospitals. So we have a number of service offerings. I won't get into the details of all of our cores. I encourage you to go to our website and learn more, but we provide funding for pilot awards as well as mentored research. We also have a number of trainings through our professional development core. Through our bioinformatics core, we help provide access to electronic health data and build inter-institutional infrastructure. And then through our biostats, epi, and research design core, the leads within that core provide quantitative and qualitative training and expertise to help folks build an impactful program of research. And then lastly, we have the community engagement core, co-led with Allison Tovar, Chuck Eaton, and Joe Diaz. And we help facilitate the training and integration of community engaged research into all of the different grants that we fund, and try to build the infrastructure for eligible investigators with regard to community engagement. So what are studios? Studios facilitate a culturally appropriate and respectful conversation between community experts or stakeholders and a research team who is planning, carrying out, or disseminating information about a relevant investigation. And so each studio is typically 90 minutes. We recommend that it be conducted in person if you can, and that folks share a meal with the community experts. But it can also be done virtually if that's needed from a feasibility standpoint. And I'll tell you a little bit more about the details of the studio, but essentially what they can do is they provide a cost-effective and time-efficient way to engage community stakeholders to help gain valuable feedback on a research concept or a study design before actually writing the grant or implementing the grant and spending valuable time and resources. And so it can help researchers prioritize research topics and approaches that are endorsed by a community. It can also help increase the relevance of the research to patients and communities. It can help strengthen recruitment and retention efforts, as well as increase dissemination reach in terms of results, as well as the uptake of research findings. So essentially what it is a moderated group discussion between an investigator and a community expert to explore in-depth opinions and reactions on a particular topic. At the end, I'll do a side-by-side comparison to focus groups, but it is quite similar to focus groups, except probably the main differentiation is that it's not research. So institutional review board approval is not required. And that's really a huge strength of this work, is that, we all know how long it takes prepare IRB applications to get IRB approval, and that can often be prohibitive for folks who are trying to get information relatively quickly to inform a grant proposal or to implement a grant or to get the findings of your research out there. And so we define community experts as people with firsthand knowledge or lived experience with a particular condition or community of interest. So oftentimes the community experts are very similar to the participants that you would enroll in your research study, but they can also be at a different level. So let's say you're working with young people and you want to talk to their parents. Or let's say you're working with women and you want to talk to their partners, right? So it can be a different level, distant or away from the community of interest. And the idea is that experts are consultants, they're not research subjects, and so they're compensated at a rate that's commensurate with what the volunteer rate would be in your area. So typically we pay $50 an hour. So studios were originally developed by Vanderbilt as part of their clinical and translational research grant. And I list a lot of resources at the end. I do encourage you to check out the Vanderbilt model. It's similar to what I'll be presenting today, but there are some differences. So essentially, when Alice and I took over in our current role, we adapted them to make them a little bit less costly and to be aligned with the mission of Advance RI-CTR, which is to build training capacity and resources to help investigators go out there on their own and conduct good community engaged research. So I'll be talking about our model today. So you may be wondering why are studios not considered research? Well, they are designed to inform the development, conduct, or dissemination of research. But as I mentioned, the experts are not research subjects, they're advisors or consultants. So if you were, just going out, starting a grant, and you were just having coffee or tea with, someone in the community to understand if this topic is worth exploring, that wouldn't be considered research. Studios are essentially that, but on a little bit larger scale. So, we typically enroll around 8 experts into any given studio so that we can get feedback at the different stages of our research. And typically studios are not audio recorded. We really recommend that because of the sensitivity of the topic potentially and for confidentiality and privacy purposes. Instead, what we do is we have a note taker, so someone who takes detailed notes. And we never transcribe anything we, develop, and this minimizes privacy concerns. In some cases, let's say you're doing a studio on your own, you don't have a note taker, and you really want to make sure that you are tracking things correctly. You may be able to audio record. We really recommend you check with your IRB to ensure that that's okay. Some of the examples that I've linked to at the end in the resource section, you'll see in their published reports, they do say that they audio record. I've done something similar to a studio in my own research. I went initially to the IRB at Brown, and then they said, no, this isn't research, but I was still able to record. I simply just got consent from everyone in the group that it was okay to audio record. And then I only used the recording just to make sure I was getting their feedback right. But I then deleted the recording after I had taken all the notes that I needed. And so the idea is you're not trying to get exact quotes. You can't actually use exact quotes the way you would from a focus group in any kind of published report or grant. You're really trying to get big picture feedback on how to potentially revise or adapt a grant proposal or a plan for dissemination. And so I'll talk a little bit later about how you would actually summarize the results of a studio in a grant proposal or in a publication. So when should you do studios? Really, studios are beneficial at any point of the research process. We do really recommend starting and planning with a studio. We know research is best done with communities, not on communities. And so even when we have these great ideas, and even if we are a member of the community that we are planning to enroll, we know there are many different voices and types of expertise within communities. And so getting together a panel of experts can really help us feel confident that the research that we're implementing is going to be successful and have impact. And so when I say planning stage, this could be true idea generation, but it could also be that you have done a pilot study and now you're going to be doing a large scale efficacy trial, and you're going to be adapting it in specific ways, and you want feedback on, the potential acceptability or feasibility of doing this in a community. It could be at the implementation stage. So let's say you had grand vision of recruiting 500 participants, and you're 2 years in and you've only got 30, and you can't figure out why you're not able to reach your intended participant population. You can then do a studio to bring together people who are representative of your patient or participant population and try to understand, why are we experiencing challenges here? Is it our recruitment materials? Are they not resonating with people? Is it where we're recruiting? Are there places we're missing that are, right here in Rhode Island that we're not aware of, that community may understand? If we're having problems with retention, participants aren't coming back in for, a clinical trial or a longitudinal study, we can understand why that may be. What are some of the barriers? Maybe people are having trouble driving to the location, getting to the location during 9 to 5 hours, and we need to think about extending, study visits past 5, for example. Those kind of pieces of information that can be really helpful to the success of your research. And then at the dissemination stage, studios can be quite helpful. So let's say you get your results, let's say they're qualitative findings, and you have done your analysis and you think you got it right, and you want to bring those findings back to the community and say, hey, does this resonate with you? Is this aligned with what you're seeing in your day-to-day lives? And kind of use that member checking approach. Let's say you're trying to figure out, how do we get these findings to the communities who could actually use them and it would benefit them? And we need to think outside of just the peer-reviewed publication process. We might be able to have a discussion about that. And let's say you've done the research, you're preparing to write your next grant, but that adaptations likely need to happen, and you want to talk to the community and figure out how to do that. Some of you may be in positions where, let's say, a randomized control trial was done in Chicago, and now Providence is going to be another site. And you can't just assume that what worked in Chicago will work in Providence. And so you're trying to think, how can I implement this work here in Rhode Island? What do I need to know about the communities here to do this work well? And then you can take the findings from these studios and integrate it not only into your protocol, but your grant proposal. So this is a little blurry. I'm sorry. I'll send out, an updated version. But this actually comes from a paper from the Vanderbilt studios describing the types of studios they've done. And I'll walk you through it a little bit here. But essentially at the top, you have research topic, investigator, stakeholder, focus, stakeholder recommendations, and outcome. So you can see on the focus, you have recruitment and retention, or recruitment and consent. In terms of the topics, some of the studies looked at biomarkers for early lung cancer detection with African-American men and women over 50 who smoke and who are 25 years of age or older. And so through the studio, they were able to gather recommendations from the stakeholders or experts about how to add appropriate incentives for participants, how to shorten the consent form and simplify language, and increase font size for older people. Give potential participants more information about risks and potential effects of procedures, make referrals for uninsured participants who are diagnosed with the disease, address barriers to participant transportation, time commitment, need to take off from work, availability of someone to take participants home after procedures. And so as a result of these recommendations, the actual outcome of the studio was that participant incentives were added, recruitment materials were amended, and consent documents were simplified. So you can see these are kind of big picture recommendations that result in very pragmatic and important changes to the study design. And it may have been that, the work was implemented without the expert opinion. A lot of these problems might happen where people aren't showing up because they have to take off time from work, or they can't read the consent because the font size is too big. It's better to know this information before we start doing the work. And so that's how studios can happen at the planning stages, how they can help at the planning stages. In this example, we see intervention design, research design, as well as research design and dissemination. You have everything from design for an ICU survivor clinic to long-term effects of opioid analgesics, and then parent-based sleep education for children with insomnia. And so you can see the different stakeholder panels typically fit the patient population or participant population that would be enrolled, and then the different types of stakeholder recommendations. So for the parent-based sleep education for children with insomnia, they enrolled the parents of children on the autism spectrum. And so in this case, they didn't enroll the children themselves, they enrolled the parents to get feedback, because the parents would have to consent or assent to having their children enrolled in the trial. And so it's good to get parents' input on an intervention before you start implementing or recruiting their children. So some of the things that came up were addressing barriers to participation, mode of delivery, who conducts the training, tailoring to patients' priority outcomes, using face-to-face and online delivery, using layered approaches to meet needs of learners at all levels. And so then the researchers translated these outcomes into a grant that was submitted. It resulted in changing one of the sites where the intervention would be implemented. And the stakeholders had recommended a community advisory board that then was implemented into the study procedures. So again, links down here to the actual paper that cites all of these different types of ways in which people have used studios to get feedback at key stages of their research. So what happens when you want to plan a studio? Well, there's a number of things you need to have. And I've used an asterisk to indicate things that are required, and then I'll talk through some of the things that are optional and why they may be optional. So you need someone to coordinate it. That takes time and effort, and I'll talk about some of the resources that are needed there. You need people to recruit for the study, for the studio. So in some cases, let's say you're a clinician, working in a community clinic. You may be able to easily put up a flyer in your clinic and recruit directly from there. Other times, it may be harder to recruit the expert panel, and so those are some of the things that can take a little bit more time on the planning stage, on the planning end. So you need a lead facilitator. So through Advance-CTR, what we really want to do is train the investigator themselves to facilitate the studio. The investigator knows their research better than anyone else, and they know, where there's gaps, and they know how to probe around topics that they want feedback on. And the thing that's nice is, unlike a focus group, you can have a set of questions that you want to ask, but you're not wedded to actually ask all those questions. You can go in different directions. There's flexibility because it's not IRB approved. So if someone says something of interest, you can ask a whole new set of questions right there in the studio. And so what we do through Advance-CTR is we do consultations and trainings such as this to help give folks the skills to facilitate. We also have a qualitative training through one of our other courses, which I'll talk about at the end, where you can get some support on how to facilitate and develop a facilitation guide. We also recommend having a co-facilitator if you have someone. That can just be someone who maybe takes more of a backseat role, but who's listening, who's observing, who's watching folks in the room, and trying to see who may not be speaking up, and kind of reading people's body language to know when to probe further or when to maybe step back. And I'll talk a little bit more about the actual process of facilitation in a moment. And then you need a note taker, so someone who can take detailed notes about all the recommendations that came up. We also ask the experts to take notes while they're in the studio, and we collect those notes at the end so that we can pull together both the note takers' notes and the experts' notes to inform to create a summary of our recommendations and inform adaptations of our research. So then we need the community experts. We need, so Hilda, the wonderful Hilda Castillo, is our resident expert in recruitment and community engagement. And it can be quite hard and time consuming to find folks to participate. It just depends on what relationship the investigator already has with the community. But typically we say, let's shoot for 12 people, and knowing that maybe 8 will show up. We generally want kind of a sweet spot around 6 to 8 people enrolled and participating in the studio. But you can definitely work with less if needed. And so when we use the term eligibility criteria, it's not really the same or as rigid as what you would have for your actual study. So you may have different exclusion criteria for a study, but for a studio we might just say women 25 and older who've experienced a UTI or something like that, and not necessarily be as concerned about geographic location or whether they're taking specific medications or whether they've been in certain types of treatment before. And really, we do recommend that the experts shouldn't have like strong prior relationship with the investigator, like a current patient. We want the experts to feel free to speak and share, we don't want to have any of that social desirability that can happen if the not that it doesn't happen to some degree, but it may be more so if there's that power dynamic there. So another piece in terms of resources is you need a space to host the studio. It can be in person or online. For folks independently conducting a studio, sometimes online is easier. It can also be easier for your participants. So let's say your study is Rhode Island wide. It could be hard for people to get from one part of the state to Providence, right? And so, you may want to consider a virtual option. Let's say that you're working with a population that tends to work nights, and so you have to do it during the middle of the day, and that might be more feasible to do virtually. But if you can, we do like it when people can come together in person and share a meal. We really build in that meal time at the front end of the studio so that it's actually 2 hours in length. That meal time gives us opportunity to connect and build rapport differently than we would, let's say, if it was a research study, right? We sit down, we get to know the experts in the room. We help put them at ease, and something about sharing a meal tends to do that. And that also gives people time to arrive too and complete some like the intake form and things like that, which I'll go over. So when we think about location, ideally we want it to be in a location that's accessible to our community experts and in an environment that feels comfortable. If they have to go through like 10 chains of security and all this badge, and documentation to kind of get into the building, that can make people feel kind of uncomfortable. So, if you can choose a community space, it could be a library, it could be a space here on campus, but make sure that people can easily access it. If they're, sometimes we are restricted where they have to use a badge to get up to whatever floor, make sure you're outside greeting people or you have someone there greeting people so that you can kind of escort them in and make them feel comfortable. There's other ways to help it be easier to find. We always use balloons outside the building so people know how to find us, and that we provide day of support. So giving folks our phone number, someone on the study team our phone number, putting signage outside the door. If you're here for the studio, please call, things like that. Just ways to make it as accessible and stress-free for people to get there. And then virtually, again, it may be best from a feasibility standpoint, and that's okay. In terms of payments, we pay people for their time, and we recommend cash if your institution allows it. We know there's different restrictions at different institutions. This is, from a participant perspective, the preferred form of payment. Of course, you can do gift cards, whether they be physical gift cards or Amazon gift cards, if your institution allows it. At Brown, for example, I recently learned that you can do honorariums. They're kind of just one-time payments. They get a check, but they do have to register with supplier management, and it can take up to 30 days for them to be paid. So sometimes I'll provide all of the options and allow the experts to choose which one works for them. That way, we're not making assumptions. So we know that there's institutional restrictions, but trying to meet your experts where they're at and pay them in a way that is useful for them. And again, food, meal, typically we do have dinner. We'll often do our studios, have people arrive around 4:30 or 5, have a meal with them, and then start the studio, which is typically around 90 minutes. You want to be thoughtful about who you're enrolling. So for example, if you're enrolling folks, who are 70, 80 above, maybe you want to, have your studio late afternoon, so that, people aren't driving back in the dark. We recently had a studio where our experts indicated that they'd like to be home by a certain time. And so we adjusted our studio time accordingly. So it's just really being community engaged, being thoughtful, trying to understand who it is you're working with and making it as accessible and easy for them. So for example, if folks aren't good with technology, maybe Zoom is not the best way to host the studio, for example. And then if you are having it in a location where there isn't, where people have to pay a meter or parking is expensive, if you can provide vouchers for parking, that's great. But if you can find a community location where there's parking lot and it's accessible, that's always ideal as well. So this is a lot to take in. This is more for you all to use. We'll be posting the slides online, so you'll have access to this, but this is kind of a basic breakdown. So we typically say studios cost around $1,500, but they can range from $600 to $2,000 depending on which components you incorporate. So obviously we want to compensate participants. If you have 8 to 12 experts and we're talking about $50 an hour, this can range from $600 to $1,200. We typically budget for 2 hours, including mealtime. But ways that you may be able to save on cost here is by enrolling fewer experts, hosting virtually, because then you wouldn't necessarily need a meal and you could stick to that 90-minute time period. And then as far as meals, it can generally be around $300 or less, depending on if you're using catering or going to the grocery store. We like to have enough food for the experts as well as for the staff, so that we can sit down and actually eat with them and chat and build rapport. But if you are, say, like doing a breakfast studio or something in mid-afternoon where you don't need a full meal, but maybe snacks or something like that, that'd be another way to save some money. And then parking, again, you want enough money to potentially pay for people's parking vouchers. But as I mentioned, you can find other locations that have free parking, or you could potentially increase your incentive to account for transportation costs if that's deemed important for your community. And then space, there's a lot of space that's free and available across the university. You can definitely take advantage of that. If you do want to use a community organization, do recommend, offering some kind of compensation to use their space if you don't have a strong relationship with them, or, just to make sure that we're giving back to the communities that are supporting us. So again, different options, different ways to modify it to meet your needs. We're just kind of showing you the full range of things that you can do. So planning a studio. So at Advance-CTR, we typically say 6 to 8 weeks. And that's because, we often may not have relationships with the expert panel. And so we have to establish those relationships and go off and recruit folks. But it also requires a lot of planning and coordination, and identifying space and things of that nature. And so that's what we typically recommend. But of course, if you're an investigator who's been working with the community of interest for some time, you have strong, relationships with community partners, we have folks that have been able to do it in as little as 2 weeks. And again, this is such a short timeline because you don't need IRB approval. That saves a tremendous amount of time. And because there's so much flexibility in terms of what you present and the questions that you ask, because you don't need to have it IRB approved. So other things, coordination, you have to determine the location, whether it's in person or virtual, set the date, determine staffing and roles, who's going to be the facilitator. Do you need a co-facilitator? Let's say you're in a situation where you do speak some Spanish, but you want to have the studio largely in Spanish. Maybe you want to have an interpreter. I know that there's interpreters often available through the medical school, or you maybe want to have a colleague or a research staff member who speaks Spanish who can help you co-facilitate. If it's a population that maybe there's been a history of distrust and you're not a member of that community, you might want a co-facilitator or someone from the community who can help support you and bridge that trust. You also have to determine how much you're going to pay and the method of payment, and work with your institution to fuse a payment that is allowable. And if you are thinking that you might want to record, check with your IRB to make sure that's okay. Then you need to create your expert contact and consent form. This is just really a basic form. I'll show you an example, but name, address, whatever information you need to facilitate the payment. Sometimes we'll ask a few key demographic questions that we use to summarize all the different groups that we have enrolled in a studio, but not necessary for reporting purposes in a grant or a manuscript. And then we also recommend a comment form. I'll show you an example of that. And in some cases, we've used evaluation forms just to understand for us, how was the studio? Are there things you liked about it or things that you would do differently? If you are an investigator who wants to do multiple studios over the course of your study, that kind of feedback can be helpful. But again, this isn't research. The data from these forms are not things that would go into a grant or a manuscript. So recruitment, obviously want to define the characteristics of the panel, figure out a recruitment approach. You can create a flyer and post that or send that out to community partners. You need to recruit and schedule the experts, and then of course send them reminders the day before, day of, find the right way to communicate with folks, whether it's text or phone call or email. Ensure that they have all the necessary details to arrive on time and at the correct location. So when you're planning a studio, investigators can create structural forms like this. This actually comes from the Vanderbilt Toolkit. Again, I really encourage you to look at that package because there's a lot of really useful information that you can adapt. So investigators might create a structured form, and this is given out to the studio participants or experts while you're delivering the studio. This one says, give us your general thoughts about the project, what's good about the projects, what are the challenges you think the project might have, and so on. These may be some of the questions that you are actually asking your expert panel during the studio. But we all know, for folks who've ever been in a focus group or led a focus group, some people may be quiet and some people may, we have to encourage them to speak up. But this helps us kind of systematically get information from everybody. If you don't want to put something so structured like this in place, you can simply give them a notepad, have them write down their notes as they're going along, their thoughts, and let them know you'll be collecting them at the end. Again, this is because typically we're not recording, so we want as many ways to collect notes beyond just the note taker, so that we can get a good summary of the experts' recommendations. Let's see. So when you're planning to do a studio and preparing to facilitate, as a facilitator, your job is really to create a comfortable environment that allows for open and frank discussion and to guide the conversation. So take the time to build rapport during the meal. you can be more relaxed and less rigid than you would be in a focus group, because this is a discussion. If you were going to meet with anyone who you've never met before, think about the ways that you would connect with them, build rapport. That's the same thing that you should be doing in the context of facilitation. And that when you're facilitating, you're really not there to interject your opinions. You're there to pose the questions, to listen, to probe, to follow up, and to make sure everybody's voices are heard. So ideally, we want to have researchers who've had some kind of prior experience in working with groups of individuals who are different than themselves, potentially a range of socioeconomic backgrounds or varied learning styles and communication styles. We know that not everyone is perfect at this at day one, but just being humble, caring, empathetic, showing people that you're interested in what they want to say, being warm and friendly and inviting creates the space for people to be able to share. So if you're someone who has gotten some training and support around facilitation, but you may not feel totally comfortable, or you may be a real outsider relative to the community, you can bring in someone who may have some co-facilitation skills, or who may be from the same community as the expert panel to support you in facilitating the studio. And so we do really encourage investigators with limited experience to take advantage of available community-engaged research trainings, including studio trainings such as this, focus group facilitation, qualitative research facilitation. We offer these services through our various cores to eligible investigators. And there's obviously a lot of online resources, including through the Vanderbilt studio model. So when planning a studio, you also need to figure out, what exactly am I asking? What do I hope to get out of this, right? By helping yourself figure out what the end goal is, then you can make sure that you use the studio time in the most efficient and productive way. So one thing that everyone has to do is develop a brief presentation. Typically, it's a handful of PowerPoint slides in very layman's terms, not all the, scientific details, but really describing your study similarly the way you would in informed consent, in a way that, language that's accessible for folks. And oftentimes we can include, images that help explain the study design, if that's really where you want feedback on. Let's say you want feedback on recruitment materials. You can have actual images of some of the photos that you might have on your materials, or some of the language or word choice that you'd be using in your recruitment. You could potentially pass out those flyers if you have things like that to share for people to interact with. We've had folks who've had videos that are part of an intervention, and so they've actually showed the videos to the expert panel and gotten their feedback and asked them probing questions following the presentation of the materials. We also encourage the facilitators to identify 2 to 3 big picture questions to ask the experts. And then from these big picture questions, to consider putting together a guide that may have sub-questions and probes, just so that they kind of know how to stay on track and making sure they're getting everything from the experts, particularly if the dialogue goes a little stale and you needed to kind of redirect and ask some new questions. One thing we always like to start with is creating ground rules for participation, much in the way we would for a focus group. We ask everyone to maintain the respect and confidentiality of each other in the room. We ask folks to step up and step back if they're talking too much, to kind of think about that and share, and then step back and give space for other people in the room who may not be talking as much. And to then ask the experts themselves, is there anything that we're missing here? Are there certain rules that you would like to see put in place today that would make you feel comfortable sharing? And so we typically will share the ground rules either right at the beginning, prior to the presentation, or just shortly after the presentation before we engage in a discussion. So when implementing the studio, pre-facilitation, we always encourage folks to arrive early, to get the food, to set up the space, check the tech, make sure it's all working. If you have a projector, if you have a computer, those kind of details. Greet the experts as they arrive, create that warm environment, right? If you're running around setting everything up and you can't really engage with the people as they arrive, that could create some discomfort. And then again, as I've articulated many times, build the rapport over the meal if you're in person. And then we have this contact payment form that people can complete while they're having their meal. And we don't tell the participants, we're having a meal and the actual studio will start at X time. We say arrive at the start time. That way, if they're late, we kind of build in some time during the meal for them to arrive so that we can start on time. I put a list here of all the things to bring, from a sign-in sheet to flip charts and markers, making sure obviously you have your presentation and a way to display it, and all the things that I identified as being needed for the studios. When you start the facilitator provides welcomes and introductions, does the ground rules, then delivers the presentation, and then has an expert, has a discussion with the experts and gets their feedback. And we really just want it to be discussion. You're sitting around with friends. You're just asking their thoughts. Make it casual, make it comfortable, make it easy for people to share. So after there's this guided discussion, which, all of our studios to date, folks have just spoken up. They just get going on the topic, and, it's been fairly easy to get feedback. There's always those handful of experts who may be a little shyer, and that's where, recognizing that and being able to say to them, we haven't heard from you yet. Do you have any thoughts to share? What do you think about this? So that you're really taking advantage of all the expertise in the room and not just the folks who are sharing the most and maybe the most comfortable doing so. So after the studio, if you do have an evaluation survey, just really more of an evaluation on how the studio went and things that you might want to change for next time. You'd pay participants if you have cash payments or physical gift cards, and provide parking vouchers if applicable. And then for the follow-up activities, you would write up the notes. So some people may be typing, some people may physically be writing up the notes. You just want to compile all of the notes, both those taken by the note taker and those taken by the experts, so that you have a detailed summary of the things that were discussed. If you are working in a team environment, we recommend debriefing with the team, particularly if you are planning on doing future studios. It can be helpful to really think about in real time what worked and what didn't work. And then what's key and recommended is that you make sure to follow up with the participants or the experts to let them know how their recommendations informed your research. So as part of that contact and payment form, you get their information, you ask them if it's okay to follow back up with them and share the findings. People really, really appreciate this. This is a very good practice. People gave of their time. We recognize them as experts. Let's let them know how did their expertise actually shape the work. And someday they might see, your study flyer in their healthcare center or in the place where they buy groceries, and they'll say, oh, I supported that. And they might recommend other people to participate in this study because they know the person at the helm, the investigator, cares, is engaged, and wants to do right by the community that they're working with. And that has a lot of clout within communities. And that's why we want the investigator to lead the work, because you're the face of your study, right? You're the person behind it. And so kind of taking away that, person behind the curtain really helps the community know who is leading this work. And that can go a long way. So in terms of translation of studio findings, as I mentioned, you can't record. If you record, you can't have direct quotes, and you can't report back in the way that you would a focus group, for example. So really, it's a summary of the studio process. You wouldn't provide all the identifying details, but you might say, just as earlier, that slide, that was a little blurry, that said, we enrolled parents of children with autism from the greater Providence, Rhode Island area, right? that would be a kind of quick summary of who the participant or who the experts were, but you're not providing detailed demographic information of who was there, which again is a deviation from a research focus group. So this is just an example of the ways that you might summarize, what the studio found and how it was implemented into the work in a grant or in a paper. And so at the end, I have some resources for some papers. I encourage you to go on Google Scholar and type in community engaged studio. You'll find a lot of examples of ways in which studios were described in people's published research that you could then adapt for your purposes. So in the sake of time, I'll go through some of this a little more quickly, but at the grant proposal stage, you can integrate it really at any stage of your research, as we've indicated. And so where you place it in the grant is dependent on where you plan to use the studio. So if you've completed a studio and now you're about to write a grant, you might put it in the formative research section. It's not really research per se, but you might describe the feedback that you got from the experts and how it has shaped your research. Certainly reviewers appreciate that you've already done your due diligence going into the grant, and that helps bolster feasibility and acceptability of the work. At the intervention development or adaptation stage, this is actually a modified example from one of my grants. And I didn't call it a studio, but essentially was. So, you wouldn't necessarily list a studio as an aim in and of itself because it is technically not research. But if you are, say, adapting or developing an intervention, maybe the actual aim is intervention development, and then a sub-aim could be something like conduct studio sessions with 2 expert panels comprised of community clinicians and transgender women to identify culturally relevant content and community-informed clinical strategies for incorporation into the intervention, and then iteratively refine the intervention protocol according to expert feedback. And so I can tell you these kind of things, reviewers are increasingly looking for ways that researchers have taken time or plan to take time to engage community in the process, and it will really only strengthen your work by doing it this way. Other ways that you may do it is at the recruitment and dissemination phase. If you are planning on recruiting a hard to reach population, oftentimes reviewers can say, this is going to be really challenging. You can say, we're actually doing a studio. We're going to connect with experts. We're going to ask them ways that, we might be able to find people from their community and engage with them to enroll them in our study. At the dissemination stage, at the end of your grant, for example, you might have ways in which you'll translate your findings and give the research back to the communities who gave up their time to describe in the studio process there. And so if you are, say, doing an NIH grant and you're enrolling human subjects, you can go into greater length about the studio process in that human subjects form. But so the placement of the studio description is really up to you in the grant, but we really encourage people to call attention to the studio process in their grant if they plan to use it, because again, it will increase the likelihood of funding. So just a quick summary of key considerations of studios versus focus groups. Studios, no IRB approval, shorter timeline, flexible, no transcription or analysis costs, can readily integrate findings into a grant proposal or manuscript. But some of the limitations are that you can only disseminate the process and big picture findings, nothing identifiable, and you can't report detailed demographics about the panel. You also cannot just transcribe findings or use direct quotes from research. So alternatively, if you have more time to do a focus group and you want to record, you want to transcribe, you want to provide direct quotes from your participants, you can use the focus group model. And I will say, we have done studios, they're fantastic. There's been times though where participants or experts say just unbelievably compelling, interesting information that we can't ever summarize that through note-taking in a way that a direct quote has impact. And so these are just the pros and cons you have to weigh when you're deciding, what the data that you want to derive and how you want to use the data. And how much time you have to plan and go through the IRB process or not. So just a quick note on Advance-CTR Studio. So this is a lot, but this is all online too. But at Advance-CTR, we can only fund, coordinate, and co-facilitate a limited number of studios per grant year, where we essentially do all the coordination, we do the recruitment, we train the investigator to facilitate, and then we have a co-facilitator there who's an expert from our team. So right now we're doing about 6 a year, and these tend to be, we prioritize folks who already have funding through Advance-CTR and have written studios into their grant, or who have received a letter of support from us to do a studio for them using external funding. We also have a wonderful community advisory and action board, as well as a community engaged practice-based research network. So if folks are members of those two groups, they could also be prioritized for a studio. So we have links here on who qualifies. Our eligible investigators are people who have appointments at Brown or URI and are conducting research within Rhode Island. But anyone can access our resources online. We have our website. We're building out our training resources. If you are an eligible investigator, you can also schedule a consultation with us to learn, how to do a studio, to ask more questions. And then you can also take advantage of our qualitative methods core to get additional guidance on how to facilitate and how to develop a facilitation manual. We'll be doing a lot more trainings, so follow us online, sign up for our newsletter. We're working very closely with the Swearer Center and a number of different entities across Brown and beyond, so please take advantage of that. And these are the resources that I mentioned. Again, check out the Vanderbilt model, check out some of the published studio papers to see what was done and how it was used. And if folks would be willing to take a survey to provide feedback, that would be great. We're just getting the ball rolling in terms of all these trainings, so we want to make them as useful as possible. But I'll stop now if folks have any questions, either online or here in person. Yes.
Lots of questions.
Okay,
I'll start with just one. Just as far as when you're choosing the participants, what's a good check for your not injecting bias? And how much, in the same vein, how much heterogeneity do you try to get? Like, are you better off running several studios as opposed to getting things all over the place with this smaller number?
Yeah, I mean, it really depends on which stage of research you're at and what you're trying to get feedback on. To the extent that you can have, a more diverse panel. We know even when we say XYZ community, there's so much variability in terms of opinions, lived experience, and so we do our best to try to get diversity within those groups. But because we're not doing a pre-screener, you don't always know every question or you can't ask every aspect of someone's lives to know about like how diverse they're going to be. Happy to ask. Hilda's our resident recruitment expert if you want to speak to kind of how you handle this. Yeah.
Yeah, so again, it's very important what Jackie said about the topic and where you're able to recruit, right? So there's subjects that you cannot just ask anyone in the street. You could stand at Kennedy Plaza and recruit for students. But if we had Julia, I'm sorry, I'm being asked to come this way. One of the studios that we had with Julia included urinary tract infections. That is a topic that we have to talk about or recruit at a site, at a clinic, and feasibly with the flyers present.
Yeah.
This is what we're doing. Because not everyone that's there is going to go for infection, urinary tract infection, I'm sorry. So, it can vary. Some of the ones are very easy. We were able to recruit at Progreso Latino, which is a community site, where we could just approach anyone and say, we're looking for mental health. And if you speak Spanish, we'd like to invite you to this date. If you speak English, we'd like to invite you to another date. But definitely depends on the topic.
And you can always do one and then if you feel like you didn't get the right blend of people, do another one if you have time to do that. So, but as Hilda said, we've had folks who've done one in Spanish, one in English, if
And
that's.
then you merge them?
No, they're separate
No, they're
students,
separate,
yeah,
but they're informing, right?
yes,
Right, right.
yeah.
Thank you. Excellent.
And I don't know if we mentioned that, I know you spoke about language, but we have been able to incorporate the Spanish.
Yeah.
Notes, and of course, someone that speaks Spanish myself. We haven't been able to do any other languages, and that may be something that the researcher would like to incorporate depending on the connections they have, right? Like Cape Verde would be one that you might want to have, or even Portuguese, if you have that language available.
And if you are going to do a study where you're going to enroll Portuguese-speaking people, it's important to develop those relationships, you know, at the studio stage. That will help you later on, right? So if you don't have relationships with the community that you're studying, it's a good time to start developing at the planning stage. Yeah. Other questions? I know you said you had a few, so.
Well, I'm gonna let other people speak.
I do have a question, and it's a follow-up to that. So as the investigator, you should be the facilitator, but if you're doing it in another language,
Mhm.
the investigator should really be the co-facilitator
Yes.
and have the person of the language leading
Yes.
that, and that's
Right.
an acceptable way to do it.
Yes, we actually have one coming up where that's exactly the case. And so Hilda's helping to co-facilitate, and then the investigator actually has an interpreter that they were able to get through the medical school. So that way, you know, the facilitator's there, they're seen, they're heard, you know, they can speak, and then it can get interpreted in a way, you know, some people may have some English language proficiency, but it really helps meet people where they're at when you have it.
So then because we're trying to do this, so that's why I'm asking this.
Yeah.
And the one person wants to be the facilitator because it may be in Spanish, but then you said also have an interpreter there?
In this case, that is the case. We are going to have an interpreter for this one. You don't have to if the person who's going to be the facilitator can kind of play that role between the lead investigator.
Julia had a student, her student who was running the study with her was fluent in Spanish, so she was able to ask the questions, and of course her student, which was fluent in both languages, co-facilitated and also took notes.
Yeah, but it definitely puts people at ease to like have it done in their own language. It shows that you're not making assumptions that everyone is going to be able to communicate in English or feel as comfortable sharing things in English. And sometimes people can say things in a more poignant way in their own language, and then have someone there to interpret and take notes. So yeah, those ones can be a little bit, you know, more complex, but to do, and that's why just having the planning in place to give time to identify the right combination of staff to be there.
Probably another good idea or something to keep in mind is your different Spanish, right? So you have somebody from Guatemala versus somebody from the Caribbean, Dominican Republic, and then somebody from the, you know, Spanish from the United States, which, you know, could be a little different. And understanding that, given that a little bit of lax while you're there, because what you understand for a bird may mean something else for someone else. And we have to keep that in mind and let them explain themselves.
And that can be quite helpful, like let's say you're developing a survey instrument, recruitment materials, things that are going to be participant facing. We know there's different dialects, right? So getting feedback from people from different countries of origin, you know, could be important. And that could happen in a studio environment. You know, I've also done cognitive interviews one-on-one with members of the community in a formal research process, or done, you know, key informant interviews on a one-on-one basis. Like the group model can be great for some topics, but if you're needing to get into the weeds around, does this word make sense to you versus this one, you know, maybe one-on-one cognitive interviews are a better way to go. So, you know, that's just kind of, you have to decide your timeline and then the fit, and then ability to recruit people simultaneously to arrive on the same day and be present, you know, so sometimes it actually could be more nimble to do individual discussions with people from the community than a group environment.
And just a follow up to that, we took that into consideration, the different countries, the different ages, when we recruited for that particular diabetes study, only because, we had a 21-year-old versus the 55-year-old whose experiences were different with the way they tested at home, with what they learned in the office. And so they learned from each other and taught us what we could possibly add to the materials when doing so.
Questions? I know we're at time.
We're out of time.
Are there questions online?
There's no questions online.
Okay, well, we can end it here, but ask.
Just one more.
Absolutely.
So you mentioned taking advantage of all the experts in the room. And so some people may not be willing to raise a hand, but they may be willing to do a Kahoot or something like that. So do you ever kind of introduce technology or some where they could be a little bit more anonymous, and does that
that's a
complicate the process?
No, not at all. I mean, that's the thing is there's flexibility. It's not research. You can do what makes sense for your group. We've had some topics that have been very sensitive, and some people just started sharing, and then that made other people feel comfortable sharing because they're like, wow, they just disclosed that. And then as a facilitator, someone wasn't speaking up, trying to probe them. But also to let them know what to expect going into it and what's going to be expected of them, and if someone doesn't feel comfortable sharing, anything about their lived experience or the experience of their community, they should know kind of what they're getting into, right? So that you can, people can self-select into the process. But if you want, other ways of using technology, that can be, that's kind of the idea with the comment form, is that some people may write a lot more detailed notes than they might say out loud. So you're still kind of getting that information. But then they may, eventually share parts of that out loud. So we encourage folks to get creative with it. And if you end up doing a studio and you find some useful adaptation, would love to hear about it. Because we're evolving, we're learning with each studio we do, and so that's what we're trying to do here at Advance-CTR is bring people together that are doing community engaged work to create opportunities to learn from each other and support one another. So
Really good questions. Thank you.
we can end here, but for the folks in the room, I'm happy to if you have other questions, stay and chat. So more to come for those online. Thank you, everyone.
Yeah.